Hi friends, I'm Dr. Mohammed Usman. Thanks for watching. Now let's talk about Pulmonol Syrup, its uses, side effects and price in Pakistan. Pulmonol Syrup is an antihistamine used for treating chest congestion and frequent coughing, especially caused by hay fever, colds or respiratory illness. Its anti-allergic properties can effectively alleviate allergic symptoms. Pulmonol syrup is an antihistamine used for treating allergic symptoms like rash, itchiness, sneezing, coughing, or watery eyes. It helps control the production of two neurotransmitters, namely histamine and acetylcholine, in your body. The syrup also contains herbal ingredients that fight allergy symptoms, making it a remedy for breathing issues. Pulmonol syrup 120 milligrams price in Pakistan ranges between 100 and 120 rupees per 120 milliliter. Pulmonol cough syrup is used for cough. Antihistamine relieves the frequent episodes of cough, often caused by colds or respiratory illnesses. It also helps expel the mucus from the airways, making breathing easier and reducing coughing. It is used to treat allergic reactions. The syrup contains chlorpheniramine maleate that reduces allergic symptoms, especially sneezing, coughing, or rhinitis. It also diminishes respiratory inflammation, which mitigates stuffy nose and sinus pressure symptoms. It helps relieve red, itchy, watery eyes, nose, and throat itch caused by allergies, hay fever, or the common cold. These are the general instructions regarding the use of pulmonol syrup. Take the syrup with or without a glass of normal temperature water. Take the syrup with or without food. Shake the bottle of pulmonol syrup well before use. Pulmonol syrup dosage depends upon the severity of the issue. Take the syrup by mixing its regular required dosage in a glass of normal temperature water. Drink plenty of water and stay hydrated while taking pulmonol syrup. Follow the dose and frequency of the pulmonol syrup as per the doctor's prescription. Use a dose measuring spoon. Do not use a household spoon as it may not measure the syrup correctly. Consult your doctor if coughing doesn't stop even after taking pulmonol syrup. The recommended dosage for pulmonol syrup depends on the age of the patient. However, for adults, the recommended dose of pulmonol syrup is typically 1 to 2 teaspoons 3 to 4 times a day. Those with renal or liver impairment must take medicines as per the doctor's prescription. For children up to 1 year of age, the recommended dose of pulmonol syrup is as per the doctor's prescription. There are some side effects of pulmonol syrup like drowsiness and fatigue, dry mouth, abdominal discomfort, diarrhea or constipation and headache. If these side effects do not go away or you experience any health complications consistently while using the medication, such as facial swelling or shortness of breath, seek medical attention. I hope you liked the video. Pregnant and lactating mothers should only use this syrup after consulting a gynecologist. There is a chance that this syrup might cause adverse effects on the health of the developing fetus or the feeding infant. I hope you liked the video. Please like and share our channel. Subscribe to our channel. Thank you.